My name is Jennifer DeSimone, and I work at the Inova Melanoma and Skin Cancer Center, where I serve as the Director for Cutaneous Lymphoma and High-Risk Dermatology. Our team handles melanoma of all stages, as well as caters to patients who are at high risk for melanoma and other skin cancers. Personally, I focus in two very distinct areas. The first is skin lymphoma, and the second is non-melanoma type skin cancers in patients who are immunosuppressed, usually organ transplant patients. So starting with skin lymphoma or cutaneous lymphoma, it's a very rare disease with only about 2,000 cases diagnosed annually in the entire United States. So with the rarity of that disease comes a lot of difficulty for patients when they try to identify a practitioner that has some experience catering to them. So by the time most patients are referred to us, they have a lot of unanswered questions and really need a lot of extra time and a lot of basic instruction to help explain to them what this rare, unusual problem is that they have and how we're going to treat it. Another patient population that I take care of are patients who've had a transplanted organ. So they've received a donor kidney or a donor heart, etc. Those patients take anti-rejection drugs, and those anti-rejection drugs result in basically a paralysis of their immune functionality in the skin so that they can't perform things like DNA repair, which ordinarily would allow their body to identify any usually ultraviolet related damaged portion of skin and eradicate it. And so with that whole process being blunted, patients in this situation develop a lot of skin cancers, and there aren't a lot of physicians that cater to that scenario. So I feel that these patients sometimes get bounced around between dermatology and surgeons and their transplant team, and they really need sort of a quarterback to unify their care and to make sure that they're offered entrance into a clinical trial if it may be appropriate for them, and to just sort of work as the main communicator among all of their other disciplines to ensure that every aspect of their care has been maximized. One of the huge advantages of working in my team is that I'm able to schedule dual visits with myself and with Dr. Sekwon Jang, my medical oncology partner. This is an enormous advantage to patients because they come in for the first time and they're able to talk with both of us about both aspects of their care, their specific dermatologic care, as well as any oncology-based care that they're going to need. Additionally, making things really easier for the patients and easier for the physicians are our weekly meetings where we meet as an entire team, which includes radiation oncologists, dermatopathologists, surgical oncologists, dermatologists, medical oncologists, basically anybody who you might need to take care of you with your rare disease is in the same room together discussing each case in great detail. And this is, again, a tremendous advantage to all of our patients as well as to us because we're able to get all aspects of the relevant disciplines involved, all at the table, and we really are able to come up with a unified and complete plan for our patients. My name is Jennifer DeSimone, and it would be an honor and a pleasure to be able to take care of you.